So next up is the panel to discuss funding for a lead-free future. And during this session, we'll hear from 4 experts in this field whose work has been dedicated to funding programs for lead poisoning prevention. We will have time for audience Q&A at the end, but feel free to put your questions in that Q&A button at the bottom that you've been doing throughout the morning. We'll try our best to answer them. We might have to follow up after our program today for any that we might not have time for. But let's get right to the introductions of our panelists. Matt Amon is the director of the Office of Lead Hazard Control and Healthy Homes at the U.S. Department of Housing and Urban Development, also known as HUD. Ruth Ann Norton is the president and CEO of the Green and Healthy Homes Initiative. Representative Sarah Innamorato is a member of the House of Representatives in Pennsylvania, serving District 21, which encompasses part of Allegheny County. And Wyanette Cheers is a senior program officer at Enterprise Community Partners, a national affordable housing and community development nonprofit, and she's the convener and manager of the Lead Safe Cleveland Coalition. So we'll hear from these individuals who will really talk about funding from a federal, state, and local perspective, and giving us ideas and strategies for where to access funds, how to access funds, and how to raise funds in this space. So with that, I will turn it over to Matt first to kick us off.
Well, thank you very much for having me. Very interesting and really enlightening panel today. It's a lot to take in, I think. But it's great to be back talking to you all. I don't think we've seen each other in person in quite some time. And I guess I missed this a little because you guys probably don't know, half of my relatives live off of the Pennsylvania Turnpike. So either at the end in Pittsburgh or on Bedford, which is my side. So going there means a lot to me, and coming to that area means a lot. I miss coming up there, and I would always stop off and see my grandmother, who lives in Johnstown, Windber, where I'd always get my kibasi, my halupki, and she'd always give me $5 for some reason. $5. I always laughed. I feel like I had to take it because it's your grandmother. But anyway, so it's great to be here. And let me just, in talking about funding, to me, when I talk about funding, it really is, well, what does this funding do? What does our funding do? What are the outcomes of our funding? And, our program is a little unique in the federal government. Our funding is unique in that the intended purpose is to improve health outcomes by focusing on improving housing conditions. And it's good to be in that space now, because for years, I don't think people understood, why is a housing agency talking about health? Why is HUD working all this time talking about health? And as I talk to people, it's finally good to say that, it's no longer an anomaly for a federal housing agency to talk about health outcomes. I think we are in the right space now to talk about the thing and to do everything we can, both in terms of our funding and having whatever levers that we have to work with everyone really on this call, whether you're in philanthropy or nonprofits or for-profits, community-based organizations, faith-based organizations, jurisdictions. But, ultimately by having our programs and policies focus on addressing poor housing quality, we can address inequities. We can address issues of environmental justice. And ultimately, we really can ensure that this funding supports and ensures that future generations can reach their full potential. And hearing the kids talk about it, I say kids, I'm only 50. Hearing the students talk about this morning is really impactful, because it's really about ensuring their success and in doing what we can do to help the next generation make the world better, right? And we know that this work matters, right? We know that housing plays a key role in the health of occupants. We know there's a direct link between housing quality and its impact on health. And we know that many health problems are either directly or indirectly related to the building itself. And what our programs do, and many that we hear today, really break that link between poor housing quality and associated housing problem. And, we heard a lot this morning about the value and need to make connections, right? Outreach. Bringing services into communities where they're needed most. And ultimately, even though I'm speaking at the federal level, we know ultimately everything happens at the local level. And making sure that we have that always as a primary focus, that everything we do impacts locally, really drives, how we think and how we operate in our programs. And what we do know is that we can't do this work alone. Partnerships are really critical, not only to helping families and children wherever they live, but, working with the locals who know what works in communities. And again, all of us here, health and housing agencies, community-based organizations, nonprofits, philanthropies, really, we're doing this work across the country and really doing a phenomenal job in lifting up not only future generations to reach their full potential, but really transforming communities. And for us, that's been about listening to what communities need, what we can do at the federal level and with our programs and policies to make it easier and better for jurisdictions to use, to offer more flexibility, to offer more improved ways, different funding sources, more flexibility in how we can address housing-related health hazards. So in response, we've really thought about ways in making our funding and our resources work in a more coordinated, holistic manner, rather than focus on individual hazards by themselves. So not just focusing on lead, or not just focusing on mold, or not just focusing on pest infestation, really looking at all those combined to create cost-effective methods, resulting in better health benefits, really done at a lower cost, so you can basically do more units. And, for us too, we all come from different disciplines, but we all have the exact same outcomes we're focused on, right? Funding that focuses on making families healthier, funding that focuses on ensuring vibrant and resilient communities. And really, the ultimate goal is to improve the life and quality of life for everyone. We've made a ton of progress in this work over my 30 years in doing this work. And I'm talking about at the federal level too, just the things that we were asked to do to create capacity around the country, to make it so that we focus resources on it being impactful and focusing on health, right? So all the work that we've done to establish these programs, all the work that we've done at the federal level, to lower the reference value and to establish lower dust lead standards and to establish lower dust lead clearance levels, pushing localities and using our funding as a catalyst to push pre-rental occupancy inspections. And we see them around the country. We've seen a lot of work done in terms of mandates around carbon monoxide and fire alarms. We've seen a lot of work around radon and including that in our work, and including our work at FHA too, and looking at strengthening what we're doing at the FHA level in radon inspections. We've seen a lot of work even internally with HUD too about improving our housing inspections and making sure it focuses is more on health. We've seen a lot of work, just in terms of trying to make it easier at the local level to coordinate this work. And that's been our work with not only EPA and CDC, but at the Department of Energy, and looking at equivalency standards for income so that we don't have to dual income and qualify a family. That's a huge lift, but it took us I swear 5 or 6 years to get that done. And also pushing agencies to think more broadly, right? I don't think it does any agency good to think just within their silo and to think that they're going to make a bigger impact just by focusing on their own silo. I mean, we work best when we work across all of our platforms. And that's what we've been trying to push with the agencies. And I've been glad to partner with all of them. And I consider them to be, close, not only confidants, but really friends that we've worked with for many years, both at CDC and EPA, USDA and DOE, Department of Energy. In terms of, we know that the work is not done though. We still have too many homes with lead-based paint. We still have too many kids exposed to the dangers. We have millions of homes that are in really poor condition. So what we have done is really push toward creating a historic amount of funding related to lead safe and healthy housing through our funding and resources, just even over the last 3 years. So we really have records amounts of funding available to, assess and remediate lead-based paint and other housing-related health hazards, make safety and functional home modifications and repairs to meet the needs of low-income elderly homeowners as they age in place, develop new and improved methods to identify and control residential health hazards, and really mitigate health and safety hazards to improve energy efficiency and comfort in units that are undergoing lead hazard control or healthy housing work. So, collectively, I think for us, our work and our funding comes down to really three things. And that is one, our funding should be used to mitigate the impacts of unhealthy housing. Two, our funding should be looked at a way to preserve affordable housing. And you may not think, well, I hear about preserving affordable housing. I hear a lot about on the supply side, the supply side issues and building new affordable housing. But we really need to focus on improving the existing housing stock that we have. And the programs that we have are perfectly in line with that in terms of elevating the quality of homes and ensuring that they can be maintained not only in a safe and healthy status, but also available to low-income homeowners for years to come. And that is, again, really about improving the housing stock and keeping them affordable. And the third thing, of course, is this, making sure that the funding is used to improve communities, really improve the lives of the residents and families that live there. And, all of our work collectively, comes down to just making an impact. And we've seen such an impact by just showcasing what we can do in simple terms: one neighborhood, one home and one family. And, just even showing what we do can really make an impact, and not only people understanding the value of what we do and how it makes a difference, but also bringing additional resources to bear in the community and offering leveraging resources by simply showcasing that one home. I can't say that enough, that even showing that one home makes a big difference. But at the federal level, the amount of funding that we've had over the last 2 years has increased by the billions. I mean, we have these very large structural laws that come out, whether it's the bipartisan infrastructure law, and obviously we've seen the lead service line replacement come out of that piece. We have the American Rescue Plan Act, which is really being used by communities to focus on improving housing. We've seen innovations in Medicaid CHIP with not only the waivers, but also the way people think about where healthcare happens, not just in a hospital setting, but also in a home setting. And then, of course, the Inflation Reduction Act, which is huge. And we have portions of that, a big portion of that, billions, almost 400 billion in terms of climate provisions. That's a lot of money out there. And if you look at our funding alone, I mean, we started out with one program at HUD, and it was a lead hazard control program. That was it. And that was overall, it was a $50 million program. And then in general, it kind of grew to $100 million. But where we are right now and the funding that is available to communities, we have never seen at this level. We probably have on hand more than about $600 million available. That'll be made available this year, probably next year. And so these are programs that you've heard before and maybe not have heard before. These are programs with our lead hazard reduction program and our lead hazard reduction demonstration program and our Healthy Homes program, which supplements those programs. So when you ask for lead money, you can also go ask for Healthy Homes money. Then we have our standalone Healthy Homes production money. Then we have our Healthy Homes and weatherization cooperation demo. Then we have our lead technical studies money and our Healthy Homes technical studies money and our older adult home modification program that is both in terms of urban and rural areas. And even though our allocation, has been 30 million, 15, 10 million, 5 million split between rural and urban, I mean, we could probably easily spend $100 million in that program alone. And we're talking about an aging population and ensuring they can age in place. And we've done recent visits both in Minneapolis, and I was just with Ruth Ann in Memphis, that this funding can make a huge difference in the way jurisdictions can operate in pulling the monies together, to benefit the vast amount of people, not just if you're looking at older adults, but also others in terms of our funding to really make a difference in communities. Then we have a program for radon testing in public housing authorities. And then the lead risk assessment demonstration for the Housing Choice Voucher Program, which I know that we have been asked about for many, many years to do, and now we're finally piloting it. So I think for me, I know I'm probably right at time for mine. I mean, for me, the challenge is, how can we make the most of these funds? There's just a lot of money going into jurisdictions, and how can we help jurisdictions navigate this funding, really, and really focus on pulling all these different resources together for a plan that works in the community. Some of this money is short-term, some of it's longer term. I consider ours to be longer term. I consider like the ARPA money to be more short-term, and the bill money, the bipartisan infrastructure, it has a time frame. But it's a lot of money that jurisdictions are being asked to utilize. And it really is imperative for us to assist you all in making sure that you have the resources and really have the capacity to not only get the funding, but use it, because the need is out there, right? The need is out there. And earlier on, I talked about those connections of having a set of resources and making it work in communities. And that's where we want to be able to sit with you, to be able to join you in working through the mechanics of that, to make sure that funding continues in these communities that need it so much. But it really is like the perfect storm of all this funding available. Now, what do we do with it?
Thanks, Matt. So we don't want to leave any dollars sitting on the table, is right, a take-home message. We want to make sure that communities are accessing this, they're applying for it and utilizing it. We'll drop in the chat here so that people can get alerts and get information when you release the NOFOs, so that it hits their inboxes and that they're aware. But it's a community approach, right? So I think that oftentimes we've had several of these grants all across the Commonwealth here, and we find that they're very successful when you've got a coordinated group of community partners coming together to work on those initiatives, as opposed to being a standalone project, right? So it requires lots of different stakeholders and lots of different voices to amplify the work and to coordinate it and help get it off the ground. And, I certainly heard loud and clear, tell your story, right? Capture that good work that's happening, and make sure that you have an ability to share that with others. And as you talk about this work and the amazing impact that it can bring to households, grab that and put a testimonial around it, put a picture around it, make it a living thing so that people understand it. And then others will want to participate in the programs that are happening on the ground, but then we can recognize and share with our elected leaders the value it brings for additional dollars. Thank you, Matt, so much. We really appreciate that. Don't go anywhere, because I'm sure there will be a little bit of Q&A. Let's turn it over next to Ruth Ann. And while we're doing that, I just want to make sure that people know that everybody's full bios are on the event page, and we'll drop that in the chat. We didn't want to have too much time taken away from hearing their information and their stories that they could share with you and resources. So we'll save the full bios you'll have access to, but let me now turn it over to Ruth Ann to talk a little bit more about some creative financing opportunities that she and GHHI have been involved with.
Well, Michelle, first, let me just thank you and Women for a Healthy Environment, like how spectacular you are. And I think the times that we're in really are about local communities rising up. You're going to hear that from Wynette and even from your representative here. And I think everything that Matt and I will talk about, really, it's at the local level that you solve an issue of lead. And I just want to thank you for inviting us. In 1986, we were founded as Parents Against Lead. We live every day with the commitment that the 9 parents who really set our vision and our path forward because their kids were poisoned. We were founded as an environmental justice and racial justice organization. And we are pleased that today, although I think it's taken us far too long, that today we are recognizing the role of equity and that we're recognizing that you have to look at the entire housing condition to really think about how do we put lead in all policies and how do we end this toxic legacy that has undermined so much potential and brilliance. So I want to kind of hone in on that a little bit and just say that I'm going to try to deepen a little bit the work that laid out by Matt. And I want to really think about the areas where people need to be concentrating, right? And how do we get philanthropy as one baseline to scale? And what are the real roles today that philanthropy can play? And I think you'll hear a lot from Cleveland about how well that has happened. But we look at philanthropy as a way to drive the convenings to bring these communities together that can publish papers that will help to establish evidence in the community. Recently here in Baltimore, we're a community that has reduced lead poisoning by 99.4%, but we still have a long way to go. And the ABLE Foundation here set out a path for us to eradicate lead from all housing in Baltimore, which remains a $1.4 billion issue. But I say that because what they were able to achieve in that is help to set goals that are really important as we think about whole house strategies, right? 1.4 billion to eradicate all lead, 48 million to eradicate lead where there are highly poisoned children, gives you a set of pathways on which to build. But I look at places that are happening and building in this work, and I'll talk about the work in Lancaster for one, to think about what we're doing in Lancaster as a community. And I know it's Lancaster, sorry. But here is a program that is phenomenally driven by a hospital. And Lancaster General Hospital put in $50 million out of its reserve through its community benefit program, coupled with $10 million that HUD put into the city. And then the hospital went out and got a Healthy Homes production grant. And we're still now anticipating building in with the wonderful legislation from the Pennsylvania legislature on whole house. But that hospital community benefit program lays out a pathway for 10 years, provides an undergirding of funding, right, to go out and build contractor capacity and workforce development for ownership from the community, as well as the abatement of housing. So I think looking at those hospital community benefit programs, and the thought about that is that hospitals do not create direct savings for themselves by investing in lead, but what they are doing is the social determinants of health, which is driving so much funding about who will the population be in the future in terms of their health and fitness and readiness to get in the classroom healthy and ready to learn, right? I also think about what we've done in Michigan and Maryland. Matt talked about the Children's Health Insurance Program, where we are drawing down unused administrative dollars to put to lead, asthma, and hopefully now climate-related issues. That is a key opportunity in Pennsylvania. The groundwork has been done, it's been called for, but it is one of the most flexible dollars that you can couple in is looking at that, but also administrative dollars. Healthcare is investing in SDOH dollars. If you look at what we're doing with ProMedica, where they're putting money into social determinants with Amerigroup and others around the country, using administrative dollars out of Medicaid managed care is a real opportunity, or reworking the approach for the Medicaid plan through an 1115 waiver like North Carolina has done, that allows direct Medicaid investment to go into housing as a mover of health, right? So clearly we've been looking at the American Recovery Plan dollars. I want to remind communities throughout Pennsylvania and throughout the folks around the country that may be listening, there's still a good portion of American Rescue Plan dollars that are sitting not yet used. They've been dedicated in places like Baltimore and Syracuse and Worcester and certainly in Cleveland, But in Detroit, it's been a big driver of our creation of the Healthy Home Repair Program, where Mayor Duggan put in $45 million of American Recovery Plan dollars because we needed to get to roofs, right? Without good roofs, we're going to have chipping, peeling, flaking paint. And then we brought together the Ford Foundation, the Herb Foundation, led by the Gilbert Family Foundation and ProMedica, to create a more holistic approach. We're doing that in New Jersey, where we are building a way to address lead, but coming out of the Board of Public Utilities and coupling that with electrification, decarbonization, and weatherization work. And I always want to remind folks, every community needs a lead hazard control and lead eradication program in order for their weatherization program to be successful. Across the nation, 52% of the time, weatherization assistance funds are deferred or declined because of issues of lead paint or mold, mildew, and moisture or structural defects. And so looking at now we're going to have 3 times the dollars in weatherization coming down to state agencies and local energy programs. They can't succeed without lead in that. In places like Baltimore, what we have done is built a baseline of lead eradication that includes it was the nation's first, and I think one of the very few, if any others, that we have a set aside on housing choice vouchers for children with levels of 3.5 or above and pregnant women to be able to implement that. And that is funding for that. For us, that's millions of dollars a year in funding, but also bringing together foster care inspections to reduce lead, using attorney general settlement funds like we have done in Buffalo, in Syracuse, in Rhode Island. We use that. We took Volkswagen settlement money, remember the old diesel snafu that they had, and we converted that into money to eradicate lead hazards and improve energy efficiency. And so thinking about that, but thinking also about what is coming in the Inflation Reduction Act, $60 billion is coming in environmental justice dollars. It's going to lift up a lot of the work around brownfield. There is no greater environmental justice issue that you can point to than lead and housing condition. And so communities ought to be thinking about how we look at that. But also in that program is a Hope for Homes Act that is going to help improve housing from an energy standpoint, but again, by getting away from extreme heat and extreme cold, you get away from houses chipping, peeling, and flaking on this. And then thinking about the various ways that we've been able to build other programs around health equity from philanthropy, around outcomes for education, using educational dollars. There is billions spent every year in philanthropy to improve graduation rates in school, to improve grade level reading at the 3rd grade. And you cannot make those arguments to do those things unless you are fundamentally looking at lead hazard control. And then the other trend that we are seeing, and thank you, Cleveland, who I'm hopefully teeing up here a bit, right, is this coalescing around the goals that philanthropy can help you set that can fire up and engage the community advocacy around how do you build funds, right? So if you're in a community that still has American Rescue Plan dollars, you're able to allocate some of that money to funds that can help eradicate lead and create healthy housing. And we are now working with Milwaukee, who's not only creating a whole house approach like New Jersey and like we've done in places like New York to look at that alignment, but they're also looking at how do they build on the $29 million of American Rescue Plan dollars and now move forward a fund. And these funds are really critical, work in concert with the HUD monies that Matt laid out, because HUD will have some restrictions, that you're going to need flexibility on income. You're going to need flexibility if you want to go to a higher standard, right? Let's get rid of the lead, right? Beyond managing and as much as we can. And so this allows us to do that. But so looking at healthcare, looking at government funding, maternal child health block grant money allows for moderate home repair. Low income heating assistance allows for moderate home repair. Trying to piece these together, but I'll kind of conclude by saying a couple of things. Set that goal. Understand what it looks like to have a life without lead, right, in your community. Set that number, set those metrics. Look at where you measure where the dollars are going. The Duke University wrote a study about GHHI's work to reduce lead by 99.4%. Said we delivered back $44.5 billion back to Maryland. We looked at that and said, where did the dollars go on savings? Where are they going to develop workforce, which is key? Where are they going back to the communities who endured the harm for generations? And how do we use everything from Inflation Reduction Act now Matt's $500 million program, right? Communities need to apply for these dollars. And how do we look at that as restorative justice? How do we measure it for equity? And how do we ensure every child gets in the classroom healthy, ready to learn, and that this is driven by and led by communities, and that we have the good common sense to listen to the lived experience, best policies, best programs, and the implementation there. I'll stop. Look forward to questions. Mostly look forward to hearing also from Lynette and Sarah.
Thanks, Ruth Ann. And GHHI has the ability to provide technical assistance to communities as well. So that's something else that folks tuning in today might want to take advantage of. And we can certainly put that link in the chat as well. Thank you very much.
Thank you.
So we've heard a bit about some federal opportunities and programs. Let's turn it to some state and hear a little bit about how at the state level there are things happening to address lead prevention and through a policy perspective as well as funding. So with that, I'll turn it over to Representative Innamorato. Welcome.
Good morning. Thanks so much for having me. And Matthew was talking about the turnpike. I got off the turnpike about 30 minutes ago, so maybe a little bit later, but so we had a late night in Harrisburg. And I think before I dive into whole home repairs, I do want to just uplift that we did do something good while we were in Harrisburg this week. We passed Senate Bill 522, which creates a blood lead assessment and creates a module to encourage more children to get tested for lead exposure to increase those numbers. So it's a good step forward in that space and really helping us to gather the data at a state level so we can really pinpoint where in the state we are seeing elevated levels of lead in children and pregnant people. So just want to uplift that. I can put the link in there. I don't know if we've discussed that any earlier today, but it's good work and probably of interest to the folks here. So I think before I dive into like really whole home repairs and what it what it means about lead remediation and visioning a lead-free future, I want to talk about my neighborhood that I live in. So I live in a neighborhood called Lawrenceville. It's in the city of Pittsburgh. And really what I've seen since being a representative of here and being a resident for nearly 13 years is there's been a lot of change that has happened. Since 2000, Lawrenceville home prices have increased tenfold. With that level, that kind of market change in such a short amount of time, we saw what was a traditional like working class neighborhood really experienced the impacts of gentrification and displacement. And so what that meant is Lawrenceville lost a lot of our Black population. It declined by nearly 68%. We lost nearly 50% of our housing choice voucher holders. We lost a number of seniors who were living in our neighborhood. And really, I think that story of our neighborhood and the impact that we've seen on not only the housing, but the way that flows out into a community and how that changes the way that we interact with one another, and how it changes that dynamic. That really has been the focus of a lot of the housing justice and housing policy work that I've done since being a state representative. And one of the things that we noticed in this space is like, well, why do long-term homeowners sell their homes, especially when the value of their home is appreciating? And oftentimes it's because you have people who are on fixed incomes, and they're living in a space. We have some of the oldest housing stock in the nation. So they're living in a home that they may not be able to afford to upkeep. And then you have this influx of capital that's coming a lot from the private equity sector and the finance sector. And you're getting a lot of folks who are long-term homeowners in our neighborhood will get inundated with phone calls, text messages, people who knock on their door that say, we'll buy your home, we'll give you cash. And that when they look around and they don't see any options for them to stabilize their home and create a safe and a healthy home for themselves, that is actually indicative of the dignity that they deserve, they'll sell. And we noticed that, if we were able to unlock a lot of funding for those individuals to be able to access, not only would we be able to repair homes, adapt homes, remediate homes, but we'd be able to stabilize communities. And that's kind of where the whole home repair idea started, was from that story of wanting to prevent gentrification and displacement. But then knowing, going up to Harrisburg and talking to some of my colleagues across the aisle who represent more rural areas, they're dealing with folks, communities where they can't attract investment, that there's a lot of blight, and that they're spending a lot of money to tear down homes, and the people around those homes who are, pillars of the community are suffering, and their property values are decreasing. And so, to talk about a type of program like whole home repairs through the lens of, you can actually stabilize these more rural areas that are looking to attract investment, and protect the health and safety of the homeowners that are currently anchors of the community in these spaces. It was really something that we've discovered was, something that was appealing across political ideologies. You really, like the story of whole home repairs, it starts with the community. It starts with the people who live in homes, live in aging housing stock. It starts with the folks like Women for a Healthy Environment who are doing this work every day. It looks like the folks who work for programs like Rebuilding Together, that are constantly in people's homes trying to get money to be able to repair and adapt homes so people can, live a life of dignity, increase their quality of life. It looks like the folks who are doing the weatherization programs. So really, this program of whole home repairs was designed with people at the center. And once we had the concept, once we were able to like bring a lot of people to the table, we were able to build a really broad coalition of folks that included legislators, obviously, but we had folks who were in the weatherization space and energy efficiency space. We had the realtors were interested. We had nonprofits, we had government agencies, we had redevelopment authorities, we had climate activists who were interested in the weatherization portion and the decarbonization part. So really, I think when you think about the bill that we were able to pass and the program we were able to create, it was strong because there were many voices there, but it started with the human issue of what it means to have a home. So we were able to, myself along with Senator Saval, we were able to design a piece of legislation that I think addresses a number of intersecting issues. So one, it creates, we used American Rescue Plan money, and it can be used in 3 different buckets. So one is that it's direct grants to repair homes, adapt them if someone is aging in place or they have a disability. It allows that money to go to weatherization, electrification. There are grants for homeowners. There's also forgivable loans for individuals who agreed to rent to people below 60% area median income, or accept a housing choice voucher. So working with housing authorities with this program was really important as well, because we know, and I'm sure Matthew can speak to, is that a number of vouchers get returned because they can never find a landlord or, you know, a property that is up to those standards, and there's limited resources to be able to get those up to code. It also creates a workforce component, because we know if we want to do home repairs, there's many organizations that specialize in that, and they're able to do a handful of properties every year, which is awesome. And we have a lot to learn about that, but to really scale those programs, we need a workforce that is trained and ready to go. And then it also creates more of a one-stop shop for residents. So what we've seen, you know, bureaucracies are going to bureaucracy. And when we know that folks, if we're looking at a people first approach, we know that it can be hard to navigate a number of these programs, and that if you qualify for a weatherization assistance program, for example, or a lead remediation program, you may qualify for other things, but it's a different application, it's a different entity administrating it. There are different criteria that you have to meet, maybe different sets of contractors you have to use. So it's also money to make sure to help us have one entry point for an individual and their home, and then we can work on the back end to connect the dots and connect the constellation of different types of programs that exist to make it as a streamlined experience as possible. So with that proposal, we were able to get it passed in our last budget, which was passed at the beginning of July. So we got $125 million for the state to do this whole home repair program. So we are bound by the limitations of the federal American Rescue Plan dollars, but it is an exciting first step. But because it's a one-time infusion of dollars, we also need to make sure, as we are going through this process, that we are collecting stories and data and showing that this is it's not only a noble and moral investment in people and communities across this Commonwealth, but it creates jobs. It's good for our local economies. It spurs additional investment, and that there's a climate story behind it. There's an energy reduction story behind it. So we are working on establishing the program right now. It will be administered, while it's state money, and it is administered at a county level. So counties across Pennsylvania will have the opportunity to apply for that. And here in Allegheny County, we are already building that table. We are starting out we are starting to craft this program and how we're going to implement it the same way the policy idea came to fruition, was people around the table talking about what the needs were and us connecting the dots and talking about how we collaborate instead of compete, and can combine all of these ideas. So, I really didn't talk a lot about lead, but this is money that, like, as we go into people's homes, we know that there are like 280,000 occupied homes in Pennsylvania that have severe or moderate physical deficiencies. And when we go into those homes, more than likely, we are going to find lead. And we are going to now have a tool to be able to work across programs and jurisdictions to be able to draw down the monies so that we can, again, focus on the people, focus on the families, on the individuals who live in these homes, and be able to provide them with a pathway to be able to increase their quality of life and stabilize homes and build up communities.
Thank you so much to both you and Senator Sabal for your leadership in this space. The whole home repair certainly looks at a home holistically and all of the environmental hazards that can be contained within, including lead. So this is an exciting opportunity for all of the residents of the Commonwealth. For people to follow that application process, it will be available at the dced.pa.gov website, and we can drop that in the chat so that when more information becomes available in terms of the application process, you'll have a place to go. And then I'll just very quickly say that the other additional funding that was made available earlier this year was the COVID-19 Nurturing Maternal and Child Health Initiative. And that recognized the impact the pandemic had on Pennsylvania communities. And it too allocated $10 million to lead abatement and remediation as well. So there's an influx of dollars here at the state level that we'll all benefit from. So with that said, let's learn about Cleveland. Wynette, tell us a little bit about the Lead Safe Cleveland Coalition and all the great work happening there as it relates to funding and how we can learn from all of you.
Great. Yes, thank you so much. And thanks for the opportunity to be here today. I'm truly excited to share a little bit about the Lead Safe Cleveland Coalition story. So my name is Wynette Shears, and I am a Senior Program Officer at Enterprise Community Partners. And for those that don't know, Enterprise is a national affordable housing and community development nonprofit located in 11 markets across the country, with a lot of experience in policy, housing finance, as well as serving as a convener. I work out of our Ohio market office located in Cleveland, and Enterprise serves as the convener, facilitator, and backbone organization for the Lead Safe Cleveland Coalition. And I work a lot alongside Ayana Blue-Donald, our VP and Ohio market leader, and as well as Janice Sharon, our program officer, as part of the lead team. So just had to mention that. Next slide there. So in Cleveland, like most older cities, we in Cleveland had highest lead poisoning rates in the nation. Our rates were really like 4 times the national average. So there was a lot of attention on Cleveland's lead crisis and a lot of separate efforts and initiative working to address the issue. However, there wasn't a comprehensive sort of collaborative approach taking place. There was a lot of immediate attention, there was on the issue, and there was also a threat of a ballot initiative to address some of the lead issues. And so back in 2017, 2018, the funding community came together under the leadership of Mount Sinai Health Foundation to form an informal group called the Funders Concerned About Lead Poisoning, and it included every major philanthropic organization in Cleveland to support sort of this work. They researched the issue. We went on listening tours to learn from other cities and best practices to achieve lead safety, and even visited places like Rochester, New York, to learn from them on how they reduced their rates by almost 85% at the time and over a 10-year period. And so to help fight this public health crisis, the Lead Safe Cleveland Coalition officially formed in January of 2019 as an inclusive public-private partnership, community-led effort to address lead poisoning. Do want to mention, though, that the coalition was built on the previous lead work taking place here locally for decades. This grassroots approach, there have been clinical approaches, public sector foundation that have been laid. And so today the coalition has over 500 members representing over 140 organizations, from leadership from the local and state government, healthcare, philanthropy, as was mentioned, residents, landlords, housing and community development organizations, as well as researchers, all joining arms, coming together with this idea that no child should be poisoned by lead. We can go to the next slide. So I won't read through this here, but you can look, just a note about the Cleveland crisis. Just wanted to point out that our work is really based on the research, and here's some data that was conducted by Case Western Reserve University Poverty Center, just elevating the reason why this work is such important here locally. But you'll see just some data points around children and incarceration and juvenile justice system, and then also being on track for kindergarten. So definitely data around this issue, and just wanted to highlight a few of those points there. We can move to the next slide. So research shows that children in Cleveland are being poisoned by lead-based paint. So we like to say that it's a public health crisis with a housing solution. This is one of the reasons why an organization like Enterprise, a housing organization, is leading this work. Homes built before 1978 obviously are the areas that are most at risk. In Cleveland, 90% of our homes were built before 1978. So our goal is really to improve housing conditions at scale so that children do not have the opportunity to ingest or inhale lead-based paint exposures in a home. And so it is from this focus that the coalition's first order of business was to advocate for lead-safe certification law, which I'll talk about at the next slide. So the coalition developed recommendations through its policy committee and submitted them to Cleveland City Council. Many of those recommendations made it into the law, but in 2019, in July actually, a law passed stating that beginning in March 2021, City of Cleveland required residential rental units built before 1978 to receive a lead-safe certification. It's a proactive third-party inspection system that was put in place. You would have to show either a risk assessment or a clearance examination. But the critical piece was that we knew that we needed to use a third-party sort of private state certified professionals showing that lead hazards were not identified within the home. The law was phased in quarterly by zip code between March and then 21 to March of 2023, rolling it out by zip codes. I wanted to just really point out here that this lead-safe certification really did shift our focus as a community to prevention. We no longer are waiting for children to be poisoned to act. We proactively work to make homes lead-safe before they poison our children. So that was really the thrust behind this law. So we can move to the next slide. So the hallmark, as I mentioned, of the law was just this phase-in approach. This slide here just shows the map. One of the key pieces that we knew was important was to have this ramp-up phase. So there was an 18-month ramp-up period so that we can build out the infrastructure. And then the law, as I mentioned, went into place. But this approach was really important so that we could, one, as was mentioned earlier, make sure that we had workforce year-round to work, and then also to help to manage the enforcement. So we can move to the next slide. Getting to the fund here. So the coalition, we knew that this law needed to be paired with resources, sort of a carrot and stick approach. We knew we could not mandate our way into lead safety. So especially since this was our first sort of proactive housing inspection in the city of Cleveland, we only had a rental registry on the books. So we knew that resources were necessary rather. And so we knew if we paired the law with resources, this becomes one of the best vehicles that we've seen to improve our housing quality. So if we move to the next slide, I'll start to talk a little bit about the fund. So in order to support property owners in achieving their lead safe certification, the coalition created a lead safe home fund, which was at the time, and I'll say at the time because things have shifted some, a $99.4 million 5-year fund created to make properties lead safe. Our original 5-year budget was really based on a landlord profile research that Case Western Reserve conducted for us, really on projected demand and need, but then also loan fund experience that we learn from locally, but then also looking at some best practices. So the fund is a first of its kind fund to support property owners and families in the city of Cleveland that are trying to comply with the law or just make their properties less safe. We did find that through the research that a lot of the property owners themselves were lower income. So we knew this was a way to also support them. There was a aging housing stock. Many of them didn't have the resources to make the repairs. And so we looked at this as a safety net to also support those families. We were fundraising as we went. And with the fund, it has two distinct as well as interrelated functions. One is a Lead Safe Resource Center that serves as a one-stop shop for all things related to lead, including a Lead Safe certification navigation, a hotline, Lead Safe workforce development, and lead outreach and education. And then the second phase of that, or the second pillar rather, is the Lead Safe loans and grants. And this fund provides a spectrum of loans and grants and incentives to assist property owners with achieving a Lead Safe certification. So what we did was really frame these functions and then conducted a national RFQ to select the administrators, and we selected Environmental Health Watch to serve as the administrator for the Resource Center, and then CHN Housing Partners as the administrator for our loans and grants. I do want to just mention that it was an iterative process. It continues to be an iterative process. And we iterated with those administrators once they came on board to fully sort of flesh out the programming of both of those components. Enterprise, on behalf of the coalition, manages the Lead Safe Home Fund and hold contracts with the administrators. We can move to the next slide. So I'll just highlight a couple points here. As I mentioned, the Resource Center is administered by Environmental Health Watch. It's really community-led, and really we focus on a community-based philosophy, including workforce. So as I mentioned before, they're providing navigation for people that need to go through the certification process. We have a robust community action team that's on the ground disseminating information about the importance of lead safety, but also the certification and the resources that are available. They've door knocked in every ward across the city and canvassing during those rollout periods to make sure people are aware. We did decide to have an in-house workforce development program so that we made sure that we maintained the integrity, as well as develop a curriculum around the interim control approach there. So we are the first line of assistance for those landlords looking to achieve the certification. We can move to the next slide. So just particularly proud of our action team. Here's an image of them out in the community, so we can move on there. So the Lead Safe loans and grants, as I mentioned, it's a spectrum of loans and grants and incentives to assist property owners. It's administered by CHN Housing Partners. And so if someone comes through, CHN manages the entire process from the scope writing all the way through the end to the clearance that's submitted to the city. So there is an internal construction management process. And as I mentioned before, that's really designed sort of to maintain integrity around these new systems and programs that we were putting in place. These numbers, well, actually on this next slide, you'll see a bit about the products themselves, rather. We've expanded because of the influx of dollars that we recently received. So I'll share a little bit more about that. These have been updated a bit, but wanted to show where we had come from versus to where we're going. But ideally, the products were available for people to make lead interim controls, improvement in repairs, and now we've expanded to a Lead Safe Plus, so it's also replacing. So it's repair, but then now in many instances for those properties where there's original components to the home that can't be repaired, we're replacing some of those. So we can move to the next slide. In order to help get the word out about the funding, marketing and communication is imperative. So we've developed our communications and marketing campaign, and half of it was on lead poisoning prevention. The other half was about the Lead Safe certification. So we use a storyteller approach. These are Cleveland-based leaders that are featured here. We know that people listen to and trust people that they know. So that was one of the strategies for our campaign. We can move to the next slide. And I'm moving here quickly because I know that we are short on time. One of the things I wanted to make sure that we mention is that the ways in which we're measuring our impact. There are several layers of evaluation in place to monitor this work. The law included a Lead Safe auditor. that would provide quarterly reports, which are shown here, the dashboard is shown here. So we also created a Let's Safe Cleveland dashboard where we are, it's a public dashboard where we are sharing our data in real time so people can see how things are going. But with the law, it also included a Let's Safe advisory board with landlords and community representation to monitor any unintended consequences. Currently highlighting, we're also looking to create a Let's Safe ombudsman position as well, but that's still in the works. And then our coalition also maintains a research and evaluation committee, providing a clearinghouse for relevant data on lead exposure. And as I mentioned, this dashboard that is available to track our efforts, but also used to support our committees. We can move to the next slide. Great. Okay, so with the fund, as I mentioned before, it's a public-private fund. We believe that there's a place for everyone. And so up until this point, we have received investments from the public as well as private investments. And at the end of last year, we had nearly half of our Let's Safe Home Fund at $99.4 million. And we have been fundraising along the way. We also have an active fundraising team that's working as well. But in 2022, we had awfully exciting news. We started the year with a major funding announcement from the city of Cleveland, ARPA. So they have committed $13 million into the fund. The Cleveland Clinic committed an additional $50 million into the fund. And then we also received a $1 million federal earmark. So today we're really proud to say that we have all of these types of public and private investments into our fund. So from the public sector, there's the city of Cleveland, both general revenue dollars and ARPA, as I was mentioned, our Cuyahoga County, there's Health and Human Services levy dollars and workforce development. And even from the state, we had general revenue dollars through Ohio Department of Health. And then, as I mentioned, the federal earmark. And then we also just have philanthropy at the table, both on the grants as well as PRI, and then private sector. So we have hospitals, MCOs, banks, CDFIs, as well as some corporations that have all invested into the fund. We can move to the next slide. So with those new investments into the fund, we spent a lot of 2022 really sort of visioning the next phase of the fund. And so now we have a new 7-year, $111.3 million budget. We are expanding our Let's Safe Home capacity in our programming. We've increased the capacity of our existing administrators. We're adding capacity through new additional administrators, and also expanded eligibility of existing programs of loans, grants, and incentives. With the new programming, for example, is Let's Safe Childcare. It was not a part of the law like in Pittsburgh. We knew that the regulation and the licensing is such that it needed a separate system to work through that process. And so we did create a pilot through our coalition. We released 4 RFQs simultaneously in August, and we're now wrapping up that process to have new administrators selected and on board and starting to roll out their programming by January of 2023. We can move to the next slide. So here, won't go through this in detail, but you can see sort of the comparison about where we were before and then where we are with the expansion of the 2.0. It just includes more administrators to get the grants out the door, additional administrators for workforce development to ensure we can meet that demand, as well as I mentioned before, we have more marketing, an expanded sort of evaluation. But all of this was really because we, as I mentioned, are taking feedback from our investors, our steering committee, our landlords, and our community. So with all that feedback, we're relaunching some of those products that are available to people. And I believe that's on the next slide. So here are the updated eligibility and products that are available. So the loans, not much change there. They're still available to owner-occupied and landlords up to $7,500. The grants is really where most of the change happened. They're available to owner-occupied homeowners as well as landlords. There's grant sizes up to $12,000, and there's no income requirement there. So if you are over 120%, you can receive $4,500. And if you're below that, you can get up to $1,200. So there is something essentially for everyone. And then this incentive, just the last piece I'll cover here. We do have incentives available to landlords that are looking to comply with the certification. So if you go and you get your certification from the city, you submit that to the resource center, we'll provide $750 and an incentive, a certification incentive. If you just got the certification, if someone wanted to get a 20-year lead-free exemption, we would give them $1,000, and people can get up to 50 of them max, 12 of them, 12 incentives per zip code with a max of 50. So I know that was a lot. I'll stop there, but I just want to say thank you.
It's amazing work. Oh, thank you. It's really an incredible model for many other cities to take a look at, dive deeply in, and to reach out to you for some questions in terms of perhaps their implementation and replication of the good work that you're doing. So we are over our time, but I did grab the 2 questions that are in the chat, and we can assure you all that they will be answered, and we'll put them on the website so that people have access to them. So Wyanette, Sarah, Ruth Ann, and Matt, thank you so much for sharing your time, your expertise, and your resources with everyone here so that they can take that information back to their communities and think about some strategic funding initiatives they might want to employ.